Hi, Dr. Tracy Tyson here, hoping to battle some misinformation, disinformation, and help families with making healthcare decisions. First one I wanted to talk about is, why do you get sick when you get a vaccination? What is about that? What does it mean, and when should you worry? So the main thing to consider is the reason that you feel sick or your child feels sick when they get a vaccination is because it is stimulating the immune system. So what happens with a virus, and we'll talk about viruses specifically, as you can imagine, I always think of like a little pentagon or a little crystal with some legs on it that's floating around your bloodstream. That attaches to your cells, and when it attaches to your cells, it sends its DNA into your cells, and it uses your cells, your body's energy sources, to make more of itself. When it makes a certain amount of itself, the cell's getting bigger and bigger and bigger, and it bursts open. And when it bursts open, that cell is then damaged and will have to be repaired. All those little baby viruses go out, reattach to more cells. Some of these viruses can replicate in the tens of thousands very, very quickly. The body recognizes that this is happening very, very early on. So the first few signs of infection are the alarm systems. The alarms are going off inside the body. The body will then raise the temperature to try to fight it off. The body will then release some secretions. It will release something called cytokines, which is another part of the immune system that causes muscle aches and pains and just overall not feeling good. The immune system will get started in the back of the throat, which is a big place where viruses and bacteria come in. And so the throat starts to get sore. Those symptoms are not actually from the virus, those are from the immune system. So how you feel the first day or so is related to your immune system doing its job. So the same thing happens with a vaccination, because the difference between a vaccination and actually getting the infection is no cell damage. So you use a small particle or another genetic piece of a virus to put into the immune system. It has to go into the bloodstream in most cases, and it goes into the bloodstream, and it's just enough to stimulate the immune system to say, hey, there's a problem. It grabs a hold of it, it eats it, sends the alarms off, the fever can go up, your body starts to feel bad, you can get a sore throat, body aches, don't feel good. But then that's going to go away after 24 to 48 hours once the cell damage is not occurring. So that's why your kid doesn't feel good when they get a vaccination. We call those immune effects, not side effects. A side effect is something you didn't expect to happen, whereas an immune effect you expected, and honestly, we like to see. My daughter used to see an immunologist, and one of the first questions he would ask is, how does she respond to her vaccinations? He wanted to hear that she had a fever, that she didn't feel good, that she made responses to it. That's how he knew that her immune system was actually functioning. If she didn't have those symptoms, the body wasn't doing what it was supposed to do. So I hope this helps. I'll keep putting more information out there, and we'll get through this together. Bye.